to my friend Matthew Clark. Matthew is a paediatrician based also on the South Coast in East Sussex, but he's also the clinical advisor at NHS England for the Children and Young People programme. And he's going to talk a bit about how can this vision, integration, healthier together, the glue, as people have called it, how can it support NHS England in implementing the Children and Young People's programme? Matthew, over to you.
Sanjay, thanks very much for the invite today, and nice to meet you all. I just say I've not got any slides. I'm just going to talk for a minute, and then hopefully we'll allow. I'm really interested to kind of get into the conversation in the round table later on in the session. I suppose there's a spoiler alert at the start of the talk, which, the question of the talk is, how can Healthier Together help? And I think the answer is absolutely definitely yes. And hopefully that will become a little bit clearer as we go through the talk. I wanted to thank Alison for her talk at the start, really kind of articulating so clearly and so passionately the needs of children and young people, and why it's incumbent on all of us, as whether we're policymakers, clinicians, to continue to make that case, because I think with the pressure on the NHS at the moment, it's easy for some of these more long-term child-focused interventions to feel like less of a priority than the immediate number of ambulances queuing outside of A&E. And actually, I sort of, having listened to Simon and Alex talk about their work, and I know they're not the only colleagues doing integrated work like this, and there are colleagues in North West London and other parts of the country as well. There are definitely parts of the country that have got this really absolutely right, and actually starting to sort of deliver on that vision of integrated care, really without, and sometimes I know it can feel like it's despite of the commissioning structures around them, not because of them. And I think that's something that we need to think about going forward, how we tackle some of those challenges that Simon alluded to, about how it can be difficult for systems to prioritise, and for, more pertinently for colleagues probably on this call, for local clinicians to actually get the really relatively modest time and resources they need to start to deliver services in a more integrated way. One of the things I often get asked is, what do NHS England do for children? And I can understand that's, and I quite understand why people ask that question, because it feels like there's so many priorities all the time, and I think it probably feels for everyone in your part of the system there's never quite enough focus at the moment. So what I thought I'd do is just talk through some of the things that are happening at the moment in NHS England, which have got a really strong children and young people's focus. And perhaps as we talk about those, we can touch on some of the ways I see Healthier Together being a vehicle for both information for families, which we all acknowledge is so important, but I think a little bit more than just the information for families, but actually as a way of pulling together different parts of the system to really make sure we're responding in a joined up way. So in terms of NHS England's Children and Young People's programme, we have a programme of work that stems from the long-term plan, which is closely linked to kind of integrated commissioning and primary care that we'll talk about in a minute. Then there's the specialised commissioning aspect as well, which I think is probably slightly less relevant to this conversation, but actually I think it's really important that we don't see tertiary super specialised care as completely divorced from primary community care, because actually that's where families get lost in between, and we need to keep working on that as well. And then there's the sort of emergency response part of NHS England, which I think I might just share some reflections on the kind of Group A strep challenges that we faced at the end of last year, because I think that probably shone a really bright light on some of the challenges and limitations of the way things are organised at the moment. So in terms of the long-term plan, this was the commitments that were made at the time that integrated care systems were kind of came into existence and were put onto a statutory footing. And for children and young people, in that there was a really clear focus on long-term conditions, asthma, diabetes, and epilepsy. And there may be colleagues before that have heard me talk about the asthma programme in quite some depth, but I think it's important but I think it's worth just touching on again, because I think for me, asthma becomes quite an important test case of all that we've talked about in Simon and other colleagues in terms of integration, because the vast majority of asthma is managed in primary care. Most asthma is managed by families at home in A&E, and a relatively small amount ends up in secondary care, and an absolutely tiny proportion of children end up in tertiary care for managing their asthma. And I think that compares quite starkly to the other long-term conditions in children and young people, namely diabetes and epilepsy. And diabetes, as we know, well networked in with networks, and the same with epilepsy, where you tend to have tertiary care and secondary care, and the role of primary care in diabetes and epilepsy, for children at least, is quite limited. So just over a year ago, 18 months ago, we published something called the National Asthma Bundle, which I hope colleagues have heard, some colleagues on this call will have heard of. And this was an attempt for us to move beyond clinical guidance, which NICE and others develop, because we didn't want to create another document to discuss whether magnesium sulfate or theophylline is the best IV treatment, or whether it's montelukast or 2 puffs of inhaled corticosteroids. So I think that work is done well elsewhere by professional bodies and by NICE. But there's a real challenge about how do you take all that clinical advice, and if you are sitting in an integrated care system, how do you actually organise things so that children actually get the treatment that's evidence-based and in the NICE guidelines? And I think it lends itself very well to a really kind of data-driven approach, looking at prescribing practice, exacerbations, making sure that children are getting the follow-up after asthma attacks as well. So that's been a big focus of our work. And actually, it's also been quite a helpful way of thinking about integration in the broadest sense. So not just thinking about primary and secondary care, which I think is often the bit that we get quite focused on in the NHS about integration, but think about actually, well, what do you do if children's housing is inadequate? And that's the primary driver for them ending up in hospital with asthma. What are the mechanisms we have to prioritise children being rehoused as well? So that's lent itself to quite a lot of cross-government working with some of the agencies, or in fact most of the agencies that Alison talked about at the start in her presentation at the start. And I think thinking about how we work across traditional boundaries is something, again, we might want to get into in the discussion. And then just to say, running alongside that, there have been some additional programs of work that have been put in there. There's the clinics for severely obese children, the Q clinics, which are now kind of well networked and well established as well. Hopefully colleagues will be aware of the Core 20+5 policy to focused on health inequalities. And alongside that, we've been supporting more innovative work around UEC recovery, and more recently, virtual wards. And then running alongside all of this is trying to move away from this distinction between mental and physical health, which I hope colleagues on this call will share my view that I think we've considered the two things to be separate for far too long. And indeed, many of the problems we're now facing with children and young people are kind of stuck in that, stem from that as well. So as nationally, we've been working on a piece of work to think about how do we support children and young people when they're in crisis in A&E departments and paediatric wards, and how do we work together to make sure that children's needs are met as well. So in that kind of sort of the long-term plan and mental health part of NHS England, and when I think about Healthier Together, I think about two things. One is patient information is absolutely critical in all these conditions, to allow families to manage all these conditions themselves, particularly when we're thinking about the urgent emergency care pathway, unscheduled care. I think we recognise there are some limitations with one-on-one online for children and young people, and there is work going on to address that. But actually, the resources available on the Healthier Together website are, I think, I'm not sure I'm supposed to express a preference over which is the best, but certainly in some of the highest quality patient information available for families in the UK at the moment. But also, as I said before, there's a real opportunity, I think, for local ICSs to use the framework and the structure of Healthier Together to actually think about how do I get my paediatricians and my A&E consultant and my health visitor and all the other people working together, and to use the kind of work on the pathways to drive things along. I just want to say something briefly about specialised commissioning, that I think that colleagues may be aware that the commissioning of specialised commissioning, if that's a mouthful, is moving over time towards ICS commissioning. And I think that in itself might seem like quite an abstract or technical concepts in terms of the money. But actually, I'm a DGH paediatrician for most of my time, and where I work on the South Coast, our tertiary unit's the Evelina, and it's £150 for a family to travel from Hastings to London to see a paediatrician at the Evelina, which is a lot of money for anybody, and is an extraordinary amount of money for a family, low-income family, particularly a family who may well not earn any money that day because they're spending the whole day traveling to London. And there are, of course, aspects of care which definitely need to be, people need to be in front of the specialist or having an operation at the specialist hospital. But I think if I take something like metabolic medicine as an example, and this is not to be in any way critical of metabolic medicine, there's actually an awful lot of that can be done where blood tests, urine samples are collected locally, physical examination by a local paediatrician, backwards, and then a sort of three-way video consultation type model completely changes the experience for that child who may or may not have a metabolic disorder. But actually, for that family to travel sometimes once, sometimes twice, once for blood tests and investigations, then followed up by another appointment, there is a different way that we can deliver some of those specialists, those services that I think we would consider to be extremely specialized, where we can pull the expertise in a different way. And I guess in time that can move closer and closer to families' home in terms of whether they even need to come to a district general hospital, whether this could be done virtually as well. So I think there is more work to do with colleagues. I've touched on metabolic medicine, but you can make the same argument for most of the other tertiary specialists, that there probably is more that we could do together, and thinking about integration as, you know, if we're going to be serious about integrated care, it's really from primary prevention through to tertiary care that we need to think. Just before I come on to talk about Group A strep and other health emergencies, I just want to say something else about cross-governmental working. Colleagues will be aware about the young boy who died with mould as the cause of death on his death certificate last year, and Arab's law is making its way through Parliament. So that provides a statutory footing for advice for how healthcare workers can raise concerns about housing through the local authority and through housing associations as well. And that's an example where I think we've been able to work across government to influence national policy, but then it immediately translates that if you're sitting in your GP surgery or your clinic at your DGH hospital, there will be an easier route to escalate concerns around housing than we had before. And one of the other areas that's been a big focus for us in terms of cross-government working is school attendance. And colleagues will be aware that school attendance has never recovered to anything like pre-pandemic levels. You know, I think it's easy to come up with simple hypotheses for why that would be. I think it's actually a really complicated problem. I think it's multifactorial. I think it's about societal expectations. I think it's about mental health. I think it's about health anxiety. And I think it's about a different way of parental working. There are layers and layers of things that need to be, that we need to work on to really understand why that is, and hopefully get in time more children into school. But again, this for me leads to brings us back to a discussion about the Healthier Together resources, that actually what families definitely need is really clear advice on when it's, in our view as healthcare professionals, safe to send their child to school. Safe in terms of, is it dangerous to their child to go to school, and safe in terms of, are they going to pass on diseases to other children as well? And that's something that parents understandably worry about. And again, I think the resources on the Healthier Together website are really, really high quality in that regard. So it's a kind of a good example of how there is a national policy priority across government, but actually we can point to some of the resources on the Healthier Together website as a good place for families to seek advice. I then just wanted to touch on where I think how useful resources like Healthier Together can be at times of crisis. And I think anyone who's working in paediatrics last winter will know what it felt like, certainly in the kind of end of November up until Christmas, where there was increasing rates of invasive Group A strep, quite a lot of media coverage about some really poor outcomes for some children, and a huge amount of family anxiety. and children coming to seeking urgent care, concerned quite understandably that their children had invasive Wuhan strep or scarlet fever and needed antibiotics. And to put that into context, if you take a kind of national view, there were 40% more children went to A&E in December last year than the pre-pandemic level, like December 2019, as an example. Yet the number of children being admitted to hospital hardly changed at all. So actually, it tells you something quite powerful about that. There is a desperate desire of families to seek assurance, seek treatment earlier. And I think Alison talks about this, about why A&E becomes such a valuable resource for families. But I think we all acknowledge that that resource then has knock-on impacts on our ability to deliver other services when so much energy has to be focused into the emergency department. And again, I think this is where Healthier Together were able to provide really, really clear families with advice to families with the traffic light system, when to worry, when not to worry, when to go to 111, and then also by able to use the app as well in systems that had that as well, to locate local pharmacies and things as well. I think was just another example of where Healthier Together can really help families respond at times of anxiety and crisis. So I think for today, I'll probably, Sanjay, start to wrap it up there. As I said, I think my overall, I just want to kind of express my thanks to the Healthier Together team, because we've worked quite closely together since through the COVID pandemic and subsequent crisis as well. And I think the kind of resources they've made available for families, both locally and accessible nationally, has been invaluable, and has provided a really, really helpful platform. And it's great to see other ICSs now starting to pick up the Healthier Together approach and hear about the integration work that's going forward. And if we could get everybody onto that level, then I think we'd be moving very much in the right direction for child health.